Hi, my name's Christina, and this is my video for prenatal education precautions. To start, I will go over common foods that should be avoided during pregnancy. So we have unwashed fruit and vegetables, unpasteurized dairy, deli meat and cheese, hot dogs, also raw or undercooked meat, seafood, and eggs. All of those of the above can carry the risk of bacteria like salmonella or listeria. And those can unfortunately pass through the placenta to the baby, which could potentially cause a miscarriage. Um, you also want to avoid any high mercury seafood or fish, such as shark, swordfish, king mackerel. The high mercury content of those can impact fetal brain development, and that can also cause some neurodevelopment issues. We also want to limit our caffeine intake to, I believe, less than 200 milligrams per day. If anything over that, this could cause a low birth weight or possibly even preterm labor. The next thing we'll go over is some medications and supplements that are safe during pregnancy. First, we have acetaminophen or Tylenol. This can be used for pain or fever. Those are safe. Antacids, Tums for heartburn or indigestion. Antihistamines are okay, such as Claritin or Zyrtec, but generally after the first trimester, those are okay. Some medications we suggest avoiding during pregnancy are NSAIDs, such as ibuprofen, Advil, and naproxen. These have been shown to cause birth defects when taken during pregnancy. But always go over any medication with your doctor before starting a new one just to get some information. Some supplements that we recommend taking during pregnancy are prenatal vitamins, of course, once a day. Also, maybe a folic acid, a vitamin D, calcium, iron. Those are all okay to take during pregnancy as well. But you don't want to overuse these supplements. So just make sure you're staying under the required dose per day. Some environmental factors to be aware of and avoid while pregnant are lead. Lead can be found in contaminated water as well as in the paint in your old homes. Lead has been shown to cause neurodevelopment issues in baby, so just make sure to stay away from that. Another exposure to avoid is going to be excessive heat. So no hot tubs or sauna. Also, limit your outdoor activity when it's very hot and sunny out. This can cause dehydration, which may cause dizziness, low blood pressure, or preterm contractions. Also, for the baby, the excessive heat has been shown to cause neurotube defects as well as a potential miscarriage. The third environmental exposure to be avoided is going to be pesticides. These can be found in your unwashed produce, fruits, and vegetables. So just make sure you are thoroughly cleaning those when you purchase them from the store. Also, these can be found in your yard work products. So if you're gardening, maybe make sure someone else is doing that side of it for you. The pesticides, these have been shown to cause hormonal regulation disruptions with pregnant women. And if you inhale the fumes, this can cause respiratory issues. For the baby, this can cause neurotoxicity, and it can affect the fetal brain development as well. Next, we're going to talk about drugs, alcohol, and tobacco. The following should be avoided while pregnant. They have been shown to cause miscarriage, preterm birth, and also maternal high blood pressure as well. Alcohol specifically can cause fetal alcohol syndrome in your baby, which leads to cognitive impairment, And it can also lead to the baby going through withdrawal at birth as well. Tobacco. Tobacco can lead to low birth weight, defects in their heart and lungs, which can cause some long-term complications, such as asthma, ADHD, and SIDS, which is sudden infant death syndrome. With drugs, again, birth defects are similar, such as heart and lung defects, possible cleft palate, and also going through withdrawal symptoms after birth as well. The next thing we're going to go over is travel. If you're planning to travel during pregnancy, the safest time to go would be your second trimester, which is going to be week 14 to 28. Some recommendations for traveling would be to just stay super hydrated, possibly bring medical records with you just in case something happens while you're out of town and away from your normal hospital or doctor. And that would be for flying. If you're driving, we recommend limiting that to about 5 to 6 hours per day in the car. And if you can, take breaks, walk around every so often, because prolonged sitting can cause blood clots in your legs. It would also be beneficial to wear compression socks when traveling, to also help with blood clots in your legs. We would recommend to avoid traveling to high-risk places that may have different viruses, such as the Zika virus, or where malaria is present. So definitely avoid those areas. We recommend limiting your travel in the third trimester when preeclampsia and preterm labor are of a higher concern. Finally, we can talk about your dental health. So pregnancy can actually cause some dental complications, so it is still okay to go visit the dentist. Pregnancy can cause gum disease, gingivitis. These are due to different hormonal changes. It can also cause cavities and tooth enamel erosion from changes in your diet, or if you're suffering from really bad morning sickness as well. So generally visiting the dentist, and having dental procedures done is safe during your pregnancy. If possible, schedule those for the second trimester as well. Dental x-rays are also okay. You just want to make sure you have the proper shielding when you go into that. I think we've covered all of the precautions. So just let me know if you have further questions. I know it was a lot. Again, feel free to reach out if you need anything, and congratulations again.